Medical Dilemma.
Hi everyone, you're watching Medical Dilemma right here on GNN. We'd like to thank our sponsors, St. Clare's Medical Center, LifeQuest Training and Consultancy Corporation. Still with us on the set is Dr. Villaroman to talk about addiction medicine, and joining us in the panel is Father Jerry Manlangit and Dr. Atty. Teresita R. Sanchez. Dr. Villaroman, before the break, we were about to go into the Philippine College of Addiction Medicine,
Yes.
of which you're a founding fellow. Can you elaborate more on the College of Addiction Medicine? When was this founded?
This was founded in 2005. Our founding chairman is Dr. Antonio Gauzon. He's a psychiatrist who's actively practicing in Bacolod. Among us, we were like 30 plus, and we decided to incorporate our practice into addiction medicine. We coordinated with the American American Society of Addiction Medicine. Dr. Gauzon did that, and then from that we learned. We established our own protocol, and then we tried to coordinate and redo some research and studies on what best way to treat in the Filipino setting.
Doctor,
addictions.
what people or specialists compose this association of yours?
Well, they're composed of doctors of medicine. They may be specialists.
Psychiatrists?
Yes,
maybe?
psychiatrists. There are internal specialists, surgeons, pediatric specialists.
So, what minimum requirement would you need in order to become a member?
Well, to be a member, you should be active in our society or our college, and then you have to have a qualifying examination, a diplomate examination as well. But before you do that, you have to be active for like 3 years. You have to comply with the minimum requirements. You have to research, do some research. You have to do some studying. And then when we have our board exams, you take the exams and you might become diplomate.
Would
And
you
then once you
qualify
diplomate-
also, Doc, family med?
Yes,
Would
they
you,
can.
they can be members?
They can,
right?
they can.
I see.
Because addiction medicine is not addiction psychiatry. There are psychiatrists, but that are not addiction specialists.
Ito addiction. Does this include, not aside from drugs, do they include alcoholism?
Well, alcohol is a drug as well.
Yes,
It also
I know,
includes
I agree, but,
other addictions such as internet, selfie,
Gambling.
gambling, sex.
So everything covers,
Yes.
is covered
It encompasses
here.
everything.
It's more interesting
Actually,
pala.
Yes,
it
Father.
was quite weird. My experience just the other night in Nat Geo, there are people who have some weird addiction into objects.
Yeah.
For example, there is that one who is addicted to baby powder.
In what sense? Do
In what sense that you have a baby powder, and then you scoop
You
it
sniff
with
it?
your spoon and then snip it. And they are excited and they are and they had gone to psychiatrists and they said, no, I don't think I'm going to change my lifestyle. I want to be that way. The others also are addicted to eating mattress.
yeah. This is
just
particular
another
term for
Cotton
that,
mattresses,
Cotton
yeah.
mattress.
Kapok.
Yeah.
May
Kapok,
term
yeah.
yun eh.
Yeah.
And then also
That's called paika.
Yes, that's it.
and then also addicted to balloon or even to cars.
Oh,
They
the
said that-
cars.
They would even say, no, I have even a sexual and emotional relationship with my car. I don't think I'll be able to live the way I used to without my...
Without a
Well,
car.
the first thing
Something
you have
like
to do
that. I
is
don't know.
differentiate it between a mental, if it is really an overt mental problem, you know. But to separate it from an addiction is that if the activity is repeated and it compromises your work, your productivity, your family, you get into risk with the law, or your health is compromised, then you could say it's an addiction.
As a matter of fact, they even, what you call this, they don't even work anymore because
Yeah.
they say that I can't go out of my house, I just want to be there because I want to be with my balloon or something like that. I don't know, that's probably insanity
These are probably bordering on psychiatric psychosis probably, but I'm not a psychiatrist to judge that. The best thing, for me, when we manage patients, we have to also determine is a person's behavior or addiction secondary to a mental disorder, or is the mental disorder secondary to the addiction? So, itinitingnan namin yan. Kaya nga, when we examine the patient, sometimes we have to refer to other specialties. like psychiatrists. We can co-manage patients.
Yeah.
In St. Clare's in particular, in our 6th floor, we have a detox facility there. We admit patients there. And then, kung nakita natin na merong problema ang pasyente na mukhang psychiatric, we refer them accordingly. So, I must also make it clear that detox is not rehabilitation. It's preparing the patient. It's the first step you take before you put a patient into a rehab
So
facility.
it doesn't end there. Only.
No, it does not. Detox purpose is to remove the drug from the body, control the withdrawal symptoms, condition the patient to enter into a rehab program, determine if there are co-occurring disorders or comorbid disorders, if the patient's doubly diagnosed with a psychiatric disorder or triply diagnosed with a psychiatric disorder, addiction, or a medical problem. And then we deal with it accordingly. So at the end of the day, the patient is prepared to undergo the program. He is motivated to undergo the program because some degree of counseling and motivational interviewing is done.
Yes, I think, Doc, that's very important because some, if you just do detoxification, no, wala, they easily fall back to their old habits, right?
That's the problem. Detox is not the end. It is just the beginning. And with my patients, we make sure that this patient's relatives are motivated as well. The patient is motivated. And all the needs for the patient is prepared, yung kakailanganin. So we devise treatment plans for them as early as detox.
Doctor, in your experience, what is the main cause or other causes why they go into drugs?
Well, there are many causes actually. One is yung environment. Second, probably is yung tao mismo, they have certain weaknesses or they immaturities. But remember,
Lack of
many
character?
people get into drugs when they're adolescents. I can understand that. Peer pressure, di ba? But you have people in their 30s, 40s, 50s. I even had a patient who started using drugs at 67.
Oh my
And
God.
became
That's so-
addicted.
Delikado pa
But-
pala.
but this is-
Delikado pa pala tayo.
Family men, they had a paramour and the paramour taught them and they thought probably it was
Oh my God.
the shabu probably was something to help them with their performance.
Work,
But this is an exception, no? These are a few exceptions. Majority of them are, if you look at the data of the Dangerous Drugs Board, majority of drug users are in their mid to late 20s or early 30s. Majority of them are in the middle income group. Majority of them are high school graduates.
Also, baka they can't find any job, that's why
Well,
they fall into that. No?
malaking factor kasi ang peer pressure also. They get
Company,
introduced.
the company.
But also remember the pathophysiology of the substance itself. A stimulant is like a switch. If you're insecure, you're depressed, you're sad, you feel inadequate in certain ways, it's like a switch. It will probably suddenly make you feel confident. It'll rush you up,
Right.
But that rush is only temporary. Because the liver will metabolize that drug for a certain number of hours. Then it will go down. When we go down, they go into a period what we call an amphetamine crash. That is what the drug user doesn't want to experience. Because contrary,
What do they feel?
they feel depressed, they feel
Oh.
weak, they feel so blunted in their thoughts, hindi sila makapag-isip ng tama.
Just the opposite of
So
what they initially
yeah,
wanted.
and they don't like feeling that. So what will they do? They'll make sundot. They'll use again because
They'll follow it up,
Yeah.
parang ganun.
and one problem kasi with methamphetamine is the first high is always the best high.
Oh.
And
First
repeated
high of the first or
the very
first
first
high of the
high.
day?
Some people will use drugs once, twice, and never use again. But there are certain people that when they use it, they like it so much that it reinforces them to use again.
How long does it last? Yung first,
8 hours.
oh, wow. So which means that it is very, what you call it, very much an invitation or an inspiration to those who are into athletics. Because
Performance-wise,
Yeah, because there's
some people will feel confident, they will feel strong, they're able to perform in any way. But there have been studies that show people who are high on stimulants and people who are not high perform. Like for example, mental exercises and all that, there's no significant difference. In fact, even some studies show that nagdi-decrease yung performance. Kasi nagiging gang-ho sila eh. They become so wired up. It's more of the feeling, you know.
Not to mention that if you get caught, you'll be disqualified. You will lose all your.
Well, yeah, in sports, yeah, but that's not all.
Not be stopped.
If you're with our laws now, if you're caught under the influence of drugs, or you're caught using, Republic Act 9165 is very clear on that. You're in violation of either Section 15 or Section 11, possession or using of drugs. So they have corresponding penalties.
Yeah, you know, our laws, no, meron tayong magandang laws on drugs actually, and it was authored basically by Senator Lina.
Bills, you mean, Doctor, that
it's
are
already
pending.
a
bill was
law,
passed
a
by
law,
him, yeah.
yes,
He was one
and
of-
very strict, but nobody seems to be following it because
President-
it's not practical.
Precedent
Sorry,
to that
no,
law.
it's very nice, but you know, you have to be confined, you have to be in prison.
Rehabilitated.
If you
Well,
don't
Well, there are
follow,
some. There are
if you don't
some.
get rehabilitated.
The laws are. I would believe that laws are a work in progress. As we progress, you know, laws are refined, laws are amended, depending on the needs. And when they find something wrong with the law, they have to change it. Precedent to that 9165 is RA 6425, which is the Dangerous Drugs Act of 1972.
And that's the one authored by Senator
No, that was
Joey
the
Lina.
precedent.
Yes,
That was
the one
after
that was
martial law.
Oo. 100
After that,
provisions,
yeah,
actually.
they revised the law because they saw that there were some problems there. Di-revise nila. Now may mga bagong amenda, like for example with quantity. Nung araw, you cannot be caught with more than, I think, 500 grams of shabu, not more than half a kilo of marijuana or something like that. But
they have-
ngayon, dinecrease na nila. More on the amount, regardless of the quality or purity, bago na siya. So, na-refine siya. Kasi nung araw, if you have, for example, a certain amount, kunyari 1 kilo, pero ang amount
Purity
nito is 10% ang purity lang niya.
Walang
So,
kwenta
they will
yan.
base it on that lang. So, they can get away with it.
Right, right.
So there was also pre-bargaining then. Nawala na yan with the new law. But of course, there are some things that also have to be modified with that law. For example, with our new law now. Like for example, if you are court mandated for more than 2 times in a drug or in a
Yeah.
drug treatment center, you can be charged already criminally.
Even with this new law,
With this
ganyan
new
na rin
law,
yun. Which again
it's
is
there.
not practical, and
Well,
so nobody
there are
wants
moves
to
that are being done
apply it.
to change that. We are appealing. Our group is appealing, mga addiction specialists, because we believe that addiction is a chronic and relapsing disorder.
Yes.
And we should understand that if it's chronic and relapsing, recovery should be understood as lifelong.
Well, I think the fact that they made an effort to try to rehabilitate themselves, no, is a good sign. And
Yes.
and since it's really a matter of having the will to do that, because sometimes they really easily fall back, di ba? Kasalanan ba nila yun? At least they reported and tried to improve.
But you know what?
no?
What's important in addiction is not forcing a person. It's making the person understand that he needs to be constantly monitored. He needs to undergo a program for him to be armed
Yes.
with the skills to avoid using drugs.
Correct. And that sometimes they cannot do it alone. They need support, really, from family and experts like you.
Yes,
But what happens, Doc, to those who do not voluntarily go into
We have
Sa
patients in rehab centers that are admitted involuntary. Yung
The
mga
relatives can bring them in, right?
yeah, but many like in government-run rehab centers, some of them require court order. A court order for putting a patient in a drug facility is different from other court orders in the sense that it's confidential. And
Ito.
it does not reflect on his criminal record whatsoever. So, and at the same time, they're protected from further incrimination.
You know, it's government, so it's supposed to be free. But is it really free, or there's some
Well,
cost involved?
No, it's not entirely free because in RA 9165 there's an article that says cost sharing, the importance of cost sharing. So the families will have to share in the cost of treating a drug dependent.
But you have also like service patients, those who really
Yes,
cannot afford.
yes.
right?
Like in any government hospital, a certain number of beds must be given to them for free. But like in a government, like in Bikutan, the drug treatment center in Bikutan, their monthly is 3,000. It
That-
can be a little less.
That's a cost.
The cost that they will have to
of
shell out.
rehabilitating a patient. It just covers the food. Pero it's not that big as compared to other private drug treatment centers.
Right.
But you know what? Important kasi is yung support ng family also in treating. A patient will not be guaranteed recovery or continued abstinence if there's no support from the family. Importante yan.
Yeah, because that's correct.
Yeah, and
Oh, how about hoarders, if you don't mind?
Hoarders?
Are they considered also an addiction? You hoard things like...
Sometimes, yes.
Or
Ang
how about-
titignan nyo kasi basic eh.
Behavior.
I might be guilty of that as well. But yung titignan mo kasi ang basic na principle ng addiction. If the activity or something that you indulge in compromises your work, compromises your health, compromises your legal stature, compromises your relationship with your family or God or whatsoever, and despite that, despite the detriment, despite the effects it has on you, you still continue to use. That is considered as an addiction.
Okay. So what about shopping, doctor?
Yes,
Baka
I
kami
forgot to
ma-classify
mention
doon.
shopping addiction. Ito yung mga addiction
There is?
ng mga,
There is. It
ng mga
exists.
babae na ayaw nilang gumaling.
addiction for life.
Well, I just...
Go ahead, please.
Importante kasi tingnan nyo ang shopping also. Ganun din. Kung nababurnout, nasusunog na yung credit card mo, you're in heavy debt, you're getting in trouble and you still shop, it's considered an addiction. We have programs for that as well.
Okay, we have more things to discuss after this short break. Please stay with us. Meron palang shopping addiction.
Oo. Sharp ako.
Meron.
Pero it has to be
So mag-discuss
detrimental.
ng price.
Medical Dilemma